Many thanks for staying here on Joy News today with me, Benis Abu Bedu. Now, away from election-related news to some other stories. The Ministry of Health has released 300,000 Ghana cedis to the Accra Psychiatric Hospital. In a statement released by the ministry on Thursday morning, medications worth 100,000 cedis have also been supplied to help alleviate the plight of patients and workers at the hospital. Now, we've been trying to establish contact with the Public Relations Officer of the Ministry of Health, and Mr. Tony Goodman. We are not able to reach him on the line, but when we get him, we'll put him through. Meanwhile, the National Labour Commission has ordered the striking psychiatric nurses at the Accra Psychiatric Hospital to return to work while deliberations continue on their demands. The nurses have been on strike since Monday, 30th October, to protest poor working conditions. According to them, government has failed to heed their calls to provide essential medical supplies and other hospital material needed in the daily management of inmates. The nurses say the non-availability of these supplies has made them very vulnerable towards patients as they face constant physical attacks and abuses at the hands of these patients. Will the nurses heed the calls by the Labour Commission? Well, leadership has been engaging in some series of meetings with management this morning over the development. We'll follow up and bring you the latest on the outcome of that meeting, on whether they will be returning to work soon or not. Meanwhile, information available to us here at Joy News is that a number of patients have been discharged as part of contingency measures to decongest the hospital in the absence of the nurses. Let's stay a while on in the health sector. Nurses at the Adabraka Polyclinic say they're feeling the brunt of the strike by the psychiatric nurses at the Accra Psychiatric Hospital. Now, speaking to Joy News, a nurse in charge of the OPD, Cindy Oforiapia, said the current situation is affecting the quality of care they give to patients as they are compelled to equally give attention to some critical inmates at the psychiatric hospital occasionally.
Our brothers and sisters from the other side of the psychiatric unit, they are also on strike. And not on strike purposely for themselves, but for the patients. All that we are doing is to inspire our patients. All we are doing is to do and render good services to our patients, to the community, to the country as a whole. So we want all those requests to be answered and favored to us.
Is there pressure coming here from the psychiatric hospital?
Oh yes, we do get the pressures because we are close to them, so we do get the pressures from them.
I mean, because they have withdrawn their services, that's what I mean.
Yes, because they've withdrawn their services, the patients keep coming here. Some of the patients are taking the daily injections, 2 days injections, and they come here. They come here, and then sometimes it becomes difficult. Because even though we've all been to the training school, they have the specialized training. So when they come here, it becomes so different altogether here. And it looks like the government have to set up and support us, because our patients that we see here are not from the psychiatric area. But when they see them coming here for treatment and sometimes a little misbehaving here and there, it gives them all on edge and alert. So please, we are asking the government to heed to our requests. And we believe this request is going to help us, not us alone, but our patients, the community, and the country as a whole.
The Office of the National Health Insurance Authority, NHIA, in the Upper East region has, with effect from Tuesday, November 1, 2016, rolled out the capitation provider payment mechanism. Now, under this mechanism, clients will now seek health care at one particular health center, which they voluntarily choose as their preferred primary care provider for a period of at least 6 months. At a press briefing at Bolgatanga Tuesday, Director of the Upper East Regional NHIA said the rollout of the capitation provider payment mechanism will introduce managed competition for providers. Upper East correspondent Albert Sori reports.
Capitation is a payment mechanism in which healthcare providers who accept NHIA clients are paid in advance. A predetermined fixed rate to provide defined set of services for each individual enrolled with the provider for a fixed period of time. The amount paid to the provider is irrespective of whether that person would seek care or not during the designated period. Under the Ghana capitation model, clients will seek health care at one particular health center, which they voluntarily chose during registration as their preferred primary care provider or PPP. A client can only have one PPP at a time, which they can change only after 6 months. At a press briefing in Bolgatanga on Tuesday, Director of the Upper East Regional National Health Insurance Authority, SEBASTIAN ALAGPULINSA, said after piloting capitation for some time, it has now been officially rolled out.
The sustainability of the insurance scheme is dear to the heart of everybody, because health is an asset to everybody and to every nation. This is clearly informing on the numerous innovations that management of the authority is pursuing to make the scheme a success. Mr. Chairman, one of these innovations is the capitation, which is an alternative payment method available to us as managers of the scheme. This method of payment is a predetermined fixed rate which is paid in advance to providers to provide a defined set of services for each individual enrolled with the provider for a fixed period of time. We have gotten to the final stage of capitation in the region. We have been together during the sensitization stage to PPP selection. Now we want to roll out capitation finally, where people will have to go to their preferred primary care providers for health care effective November 2016, 1st November 2016.
Albert Sorry brought us that report from the Upper East region. You're watching Joy News today with me, Benis Abu Bedu.